Now, one of the questions I want to ask you, because I'm hearing this so much, is I'm a big believer in experiential medicine, meaning we experience and we get results, and evidence, of course, is important, but it's not the end all. If that were true, you just follow the evidence and everyone would be healthier or sicker and sicker. Where do you find yourself? Because functional medicine is very evidence-based. Mm-hmm. But you're sitting here talking a lot about experience. And if you followed some of the evidence that many of the doctors probably you worked with in the past were following, you got to go on this, course of action with oncology and that's what the evidence shows us, gives us the best chance. And you said, well, my experience showed me something else. Where do you fall on that between experience versus evidence?
Oh, this is a brilliant question. And I love it because I just did an interview earlier this morning. We actually got into this because she said this neuropsychologist you talked to, neurologist, was like, if it's not randomized controlled trial, then he's not going to do it. And all he was doing was SSRIs for mood. He wouldn't consider that the gut or anything else had anything to do with it. So I love that because I am a huge believer. I love the science. I was a bioengineer background. Like I'm very steeped in that science. But as I've grown and learned and seen, I'll say it like this, and then I'll tell you why. Mm-hmm. The place where we see the miracles, the spontaneous healing, the things that are like not expected, it's always outside the box. And when we stay, there's this box that says this is what 30 years of old data has told us has been the standard of care. But the data that's coming out now, it may not be standard of care for another 30 years. So I could wait 30 years and have a lot of people die and get sick and not get well. Or I can go on the very cutting edge of that data and say, okay, we have preliminary data on this vitamin C. Well, that's old now, but use something else, maybe NAD. And my mind is like, is this safe? If there is a safety profile and I know no major risk of harm or we have informed consent, and then there's a possible benefit, first of all, if it's me, I'm going to be on that cutting, bleeding edge. I do stuff to me that I would never do to patients because I'm willing to take the risk, right? I mean, I ride a motorcycle, I got to climb mountains, I do other things like that too, but I don't have any problem with risking and trying stuff on myself to see if it works. And then I can be that judge. And I often give patients that option. Of course, I'm much more careful with them and say, but what we find is when we go outside that box and we say, hey, this makes sense. There's a preliminary study on this ingredient, plasminogens and anti-aging. This is a huge new topic. And can we use this to reverse Alzheimer's? Well, there's just preliminary evidence. But if someone wants to try phosphatidylcholines or precursors of plasminogens, my gosh, that's from, food sources. It's pretty darn safe. Why not try it? So I am definitely one of those docs that is not willing to step outside the box. I hear something in a lecture. It's got decent evidence. I might the next day talk to a patient and say, hey, I just heard about this. What do you think? And then in combination. And what I wanted to say too was, again, I have this science background. I used to live from my neck up as far as analytical and problem solving. And I love to have complex equations in my head. But what I learned, the most powerful medicine, the most powerful answers, and the most powerful miracles that are unexpected healing, this happens when we trust our gut and our intuition. And whether it's tapping into the patient and saying, what do you think? What do you suspect? Most of the time, the patient, if you give them the permission to speak their truth, they have answers that are helping you to help them heal. And they know at a root cause, like something that this may make no sense to you, doctor, but I was wondering about this, or this happened with my family when I was a young child. And so all these are clues. And what I've learned in the last at least 10 to 15 years is that heart-based intuitive sense, which is not science-based, it's a gut instinct, is thousands of times more powerful than the science-based. I think of it as the old analog computer can process so many pieces of data. But when we go to the heart space, we can spontaneously process millions of pieces of data with our intuitive subconscious. And again, this isn't woo-woo. There's actually evidence to support what I'm saying. But I have fully swung. I still use both sides. I still use the science. And what I typically do is I go with that intuitive sense, and then I prove it with the testing and the science and make sure. But I'll tell you what, it is so accurate. And I get so many more really deep insights and ways to solve a problem that I would have never found if I had just stuck to the old analog computer.
Absolutely. It's never black and white. And that's what you got to see. You got to find all those different shades and the colors in between that really make sense. And I even posted about this not long ago, how, following the heart, and the heart gives off the most EMF and it's most powerful. And, I had some doctors on there saying there's no science to this, right? And it was just You can't say that, it's misinformation. And I was like, come on, like you gotta find it. I can find the science if you want,
and there
right?
is science
out there.
That's
Absolutely.
the thing, it's like really powerful science.
It's just not the science they're used to. It's a little bit outside the scope of what you're probably learning in medical school. But
even what you're saying there too, for me, just showing up and really listening with my heart and like really giving them a space that's safe, where they believe that there's hope, where they trust me, and where they know there's unconditional love and acceptance. That might have been woo-woo 20 years ago. That is not. That is a foundation of healing.
And it's something you absolutely incorporate in your practice. I remember when I was listening to you on stage at the Biohacking Conference, you talked about heart-based intention, goal setting, purpose-driven medicine, all these things that my ears perked up for that, because I love that. I know the difference with many patients. Do they have a purpose to get better? Yes. Do they have a goal to get better? Because it's not going to always be easy and linear healing. You'll have bad days and maybe you don't want to go through with it and change your lifestyle. So you back out of it and you stay in a disease state.